It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
We're here again, and I want to thank my guests for being here, and thank you for tuning in. And this is a very, very powerful show. All of them have been. But this one I find so powerful because it has touched myself and my family, and now there is something to help you with through your journey, through one of the components of our show. Our topic is dealing with, have you or anyone you know suffered from fibroid tumors, or do you know anyone who is suffering from MS? And I wouldn't bring you a show without having a solution. I'm not that type person. So we do have a solution. So I want to thank my guests for being here, and this is going to be powerful. Get yourself a pen and paper, because you are going to want to follow us this journey, but I'm going to give you some tips on different things too as it relates to diet and nutrition, which is very important. But we do have a treatment plan for you, which I'm so excited about. So my guests are Kelly. Hello. And Kelly, thank you so much. And Lisa.
Hello, good morning.
Good morning, good morning. And when you tell you, I'm going to have each of you tell, a little bit about yourself, but we're going to start and kind of dive in, because with fibroid tumors as one of our topics today, the one thing I like people to know, I treat people with fibroid tumors, and I've diagnosed them through the years. And I always ask people when they call me and say, I have a fibroid tumor. And I ask them, where is it? Where's it located? They just know I have a fibroid tumor. But there's 4 different types of fibroid tumors, and they need to know the 4 different types. You should know it's your body before, especially a lot of people go under the knife. So you want to know those 4 types of fibroid tumors, which you're going to see on the screen here, which is wonderful because of our wonderful mastermind here, Jarvis. So I want to thank you, Jarvis, for pulling those up. But those 4 locations are so important for you to know where those fibroids are, because where they're located has a lot to do with your symptoms that you're having as well. The size of the tumors and the locations has a lot to do with constipation, heavy bleeding, bleeding between periods, your period. So kind of know yourself. But in only just knowing, we're going to have a treatment plan to help you through this. So there's certain foods we'll talk about to kind of eliminate from the diet when it comes with fibroid tumors, but also, again, the treatment. And then with my dear Kelly has her own special journey. And I'm so excited that you're going to be sharing your journey.
Yes.
Your journey is just incredible because of the fact that there's several people watching right now who have been diagnosed with MS.
Okay.
And they're waiting to hear your journey right now.
All right. Well,
yes.
I...
First tell me about you.
I'm from Southern California and live in Santa Monica, California. I'm a small business owner.
Okay.
And I became sick in 2010.
Okay.
And I lost my eyesight in my left eye.
Oh, my goodness.
I couldn't walk. I didn't know what was going on. I went to the hospital, and I was told sort of unceremoniously that I had MS. It kind of hit me over the head with I felt like I was hit over the head with a frying pan, the way the doctors told me.
Who would not to get a diagnosis of that particular, yes.
Exactly. And I was sort of put into a conveyor belt of people telling me what I needed to do. They gave me all kinds of prescriptions for injections that I needed to inject into myself every day for the rest of my life.
But you're very young. I'm looking at you, and you're a very young lady, too. And this is how it started. The symptoms started that way. You had no other warning?
I probably ignored it. I probably ignored things initially, and it hit me right away and presented itself with blindness in my left eye. And when I went to the doctor, they put me under, took me to the hospital for a couple days and put me under a hydrocortisone drip that sort of, I guess, suppressed the inflammation enough to allow for my eyesight to come back. And from there, I tried to do everything I could think of and look up to address my issue without taking the medications that they wanted me to take, because I did not want. When I looked into them, I wasn't really happy with what I was reading.
Right. What type of testing did they do to determine you had MS?
They gave me a MRI.
Okay.
They put me in an MRI to find out what was going on with my eyesight, and that's when they saw the lesions on my brain, and pretty much took me in the back and said, "Well, we have to tell you have MS." I'm like, "You're crazy. I don't have MS."
Yeah.
But it sort of put me on this conveyor belt where they were giving me medications and things like that, and I didn't want to take injections every day. And the doctor told me, when he prescribed them to me, he never even looked me in the eye. He just was turned away and just sort of jotted it down like that, and told me that I was going to be sick every day for the rest of my life, and I would have to take this medication every day for the rest of my life. And the injections cost $100 a day.
Oh, no.
And it was as if I was hit over the head. I didn't know what to say or think. When I was leaving, they gave me this big packet of marketing materials for this medication that they wanted me to take. And it looked so beautiful and so expensive and so convincing, but I didn't believe it.
Right.
So I wanted to do my own research.
Yes.
And so that's what I did, because I wanted to know what they wanted to inject in my body, and why would I take a medication that would make me feel like I had the flu every day.
Every day. That's a bit much. You know, I do have a question. I want to stop you there, because I had a situation with a person that I knew. Her daughter had not seen her for years, and she had some dental work done. And when she had a root canal, the doctor did a filling with mercury into that cavity, and she had the worst case of MS I've ever seen.
I'm glad you brought that up, actually, because
I
forgot about that. That's how it all initially started.
I
went to the movies. I had some popcorn, and a little kernel from the popcorn was trapped underneath my tooth, and I never could quite get it out, and it started to rot, and it rotted out my tooth. So I had to go get a root canal. Well, the root canal ended up sort of avalanching into my problems. And so when I was diagnosed with MS, what I ended up doing was I thought, I think there's something wrong with this tooth.
Yeah.
And I went and had the tooth removed immediately.
Yes.
To get that out of that equation.
Yes.
And then I went from there and started doing other things dietary for myself.
Yes.
But it wasn't until the
tooth. Because there is a relationship. And, mainstream dentists sometimes say no. Your biological dentists do know. And
they do?
I do a test with the machine in my office, which is FDA approved for breast screening. But the 119 acupuncture points, and part of those points is dental. So, I look at that very closely, because 30-some years ago, I was at a conference and met a gentleman who had a condition. Then I've also had many, many other people who've had conditions based on root canal. So as soon as they did a cavitation and cleaned that out all the way to the bone, it has to be done by specialists. When they do that, the condition you start to heal. Continue on your journey with everything else, and you start to heal. But in my spirit, and we have not taken it to this step here to ask you, but majority of the cases that I've seen have been, that some dental work was done first, or some heavy metal was put in the body, or a vaccination was given.
Yeah, mine was definitely dental. I went and had a root canal that just wasn't right, and I always knew it wasn't right. It felt like there was something wrong with it.
And it was.
And I ignored it, and I ignored it because I'm like, I'll get around to it, I'll get around to it, I'll get around to it. And it wasn't until I was slammed with the whole MS diagnosis that I really realized, I'm like, okay, it is the tooth. And actually, I'm surprised that I don't remember this because I guess I kind of am blacking it out because it was so traumatic. I had to go get that tooth taken out right away because when I was in the hospital, I asked them, I said, could it be my tooth? And they completely blew me out of the water and said, absolutely not. Nope. It has nothing to do with your tooth. And so... And
it wasn't the tooth per se, it was the root canal.
It was the root canal.
And it was the popcorn kernel that rotted under there in that same meridian. And if we trace it, we'll probably see it was right on that meridian dealing with,
Absolutely. It was this tooth, and it was this optic nerve that was inflamed that caused the blindness. So, I completely agree with you. So I actually went and had it taken out, and that sufficed for a while. But it didn't fix it.
No. It's not going to fix it because you need treatment after.
Yes. And I really wish I would have known you then because all the things that I had done subsequently, I've done based only on my own research, trying to figure out what would be best for my body because I'm the only one who lives inside of it and knows what's going on with it. And to have a doctor tell me I have to put this stuff, which when I read about it, I was absolutely not going to put in my body.
Yeah. So, so now let's talk about what you did to start reversing those symptoms, get your eyesight back, and being able to function the way you are. I mean, to look at you, you would never know.
I know, right?
That you had that experience at all.
Well, my friend and business partner here was sort of worked with me to come up with a solution. I decided to take cannabis oil. I had read a lot about it and heard a lot of things about it. So, and I kind of thought, well, it says it fixes everything. That can't possibly be true. I sort of blew it out the water and sort of dismissed it like no. But then I got so bad that there was nothing else I could do. I was about to go and put myself at the foot of all the hospitals and let them do whatever they wanted to me because I was in such pain. I had horrible, horrible pain in my up my leg.
And it was all on the left side, the pain?
Initially, and then it started getting worse and worse and worse. And that's why I came to the whole cannabis thing because I was about to just give myself up to the emergency ward. Just do whatever you want because I'm in so much pain. And I took the cannabis oil with my friend here. I was at her house that day, and she sort of watched over me. And I don't know why, but I guess I was a little afraid. I thought, well, I didn't really know what the cannabis oil was going to do to me. Like, was I going to get high, super high or whatever? And
go on a trip.
And I took it at night because I figured it would be a good idea to take it at night so I could sleep through that. And now I look back on it and I think to myself, I don't know what I was afraid of. It was not a big deal. The next morning, the next morning, I woke up. I could walk, and 80% of my eyesight was back in my left eye. I couldn't believe it. Isn't that right? Yes. That's crazy.
In one night?
In one night. The next morning, I woke up. We were both floored. Right. Because
goodness.
I had been struggling. Like, I started to not go to work anymore because I was embarrassed, because I was just struggling so much. I was limping down the hallway. People were seeing me walk down the street, noticing and saying, "Oh my God, Kelly, are you okay?"
Yes.
And no, I wasn't okay. I was really sick, and I was not knowing what to do. And when I heard about cannabis, I was like, okay, let's give it a try. Yeah. And I've been doing it ever since. It sort of started to give us a reason to make a product.
Right.
Because there were other people that were suffering, and they wanted to know what I was doing. And so we made this suppository product because we realized that if you take it this way, there's no psychoactive effect. So I'm a busy woman. I work every day. I'm dealing with a lot of professional people. I cannot
look like you're
stoned. I can't smell like I'm stoned.
Exactly.
I need to function. I need to be clear.
Yes.
But I needed the benefit of the cannabis and the cannabinoids.
Yes, exactly.
Yes.
And that's the component that helped you to heal.
Yes, it did.
You know, your journey is just incredible, like overnight.
Overnight.
Oh, my goodness.
Now, I don't know that would work for everyone else. I initially took mega doses of cannabis oil just because I was so sick that I thought, okay, well, I don't know. I just have to do whatever I can do. And the cannabis suppositories are a much lower dosage because I take them regularly to help and support my endocannabinoid system.
Right.
So,
yeah, we work with them at our clinic now, and they're absolutely wonderful. And you'll be able to go to the website and order them through Dr. Lee's site with a discount coupon.
That's correct.
You know, I just want to let people know this show is not an infomercial by no means, but I'm telling you, I like to know whatever there's out there to help a person to heal. I want to pass it on. And it's so reasonable, you know, to what you experienced in one night. But first you dealt with the dental. That's why you healed faster. And that's what happened to cancer patients. Sometimes once they deal with that root canal, the dental, everything else starts to fall into place and they heal a lot faster. So that was the key in number one. Yeah, how powerful that is.
I sat there and thought, I have to get this tooth out of my mouth. I know this is something that is infecting me and causing me problems. So I didn't even tell the dentist that I had been just let out of the hospital because I was afraid he would say no, he wouldn't do it. And all I knew was I needed to get this this thing out of me that was rotting in my head.
And I tell people, please, please, please see a biological dentist. I work very closely with two, actually three. One we've had on the show before as well. But she's not in California. But you have to really work closely with a biological dentist, someone that's good. And I've met some very good people. So I am so thankful for your testimony here and your journey, but not just your testimony is still progressing. And now you're out to really help, you know, other people to heal. And I mean, this is such a powerful testimony. It really is. And I don't know. I know I keep repeating myself.
It's powerful for me because I was not walking. I was not seeing. It was getting to the point where I knew that my clarity in my brain was starting to go too.
Yes.
So that's when I started becoming really afraid and wanting actually to go to the hospital because I'm like, I can't even, at this point I wasn't even being able to think straight.
Yes.
So everything turned around after we started using the suppositories.
Yeah. Well, you're absolutely a beautiful young lady.
Thank you.
Have been truly, truly blessed. And I know people are going to want to check into more of the suppository and get them ordered. Just make sure they go to the website, this link. Go ahead.
Actually, we set up a special link just for Dr. Lee's audience. It's suppositry.com/Dr. Lee. You would put in a coupon code that says Dr. Lee. This gives you a $19.99 discount on the price. And
yeah, because I can't keep it in the office.
Yeah, we're having a really hard time keeping the product.
Oh, yeah.
Lots of people are using it.
And you hear a lot of pros and cons, but you know, in certain countries, a lot of the treatments are done rectally. And I've had a couple people in comas, and I wanted to get them their B12. Well, it was a couple other things too. And so I just did it rectally, and it was amazing how things start to turn around faster.
Well, on our site, if you look under Learn, there are some videos for people that they can watch and learn a little bit about, one, the endocannabinoid system.
Yes.
And two, about our approach, which is a low dose version of the cannabis suppository that people are hearing a lot of good things about taking it in low doses, so that it really upregulates your endocannabinoid system and really helps to support you holistically.
Yes,
so
indeed.
I
said, I'm not going to go into a lot of detail about it on the show, but I do work very closely with a lot of people with it, and the results that I'm seeing has just been amazing. I'm really, really excited about the product. And so if you have more questions, too, as relates to, because there are a lot of other things you need to know and do with MS. You want to do a hair analysis for heavy metal and get that detox. You want to make sure that you're not adding any neurotoxins into your body, like aspartame.
Like toothpaste?
Like aspartame, which is, Yeah. And anything that, your deodorants that are toxic as well. So with aluminum. So it's going to add heavy metal. Toothpaste, yes, because a lot of toothpaste will use aspartame, but a lot of them have aluminum. So you don't want to add any more heavy metal into the body. So it's very important to get a hair analysis. It's really important to watch the diet. It's very important for the nutritional aspect is number one as well.
Right.
We have to put that at the top of the list with the whole healing process. And I'm sure you had done a lot of that before you got to the cannabinoid, the CBD. So
it's amazing stuff, really. I just can't even underscore what a result I got from it.
It's amazing.
Health, diet is important.
Yes. And again, listeners, if you know anyone or yourself that is suffering from MS, please give me a call at 310-871-8721. Let's take you through everything that's needed. But the treatment plan is just so wonderful. This is one of the most amazing treatment plans that I have seen. I thank you so much for that.
Thank you. Well, we sat together and put this formula together. We went through different versions of it and different processes to figure out what worked best. And so we're pretty happy with the result.
Yeah.
I agree.
So now I'm going to bring on Lisa.
Hello.
Because
Hi.
Lisa has her own journey. And Lisa, tell everybody first who you are.
So my name's Lisa. I'm originally from LA, grew up in Santa Monica, and I'm a small business owner. I've been in the medical field for a long time.
Very good. Very good. And I know you're a little happy over there because that chair is a little rocking.
I know.
And we don't even have
need to
music.
stop.
So we don't even
rock
have
all
music.
by myself.
I just want to thank you so much because I met you first. Correct. And through a very dear friend who was doing Dining Out Healthy here with us.
Right.
And I just want to thank Marie for introducing me to you, because that's the beginning of this journey,
right?
Which has been amazing. So, Marie, if you're watching, thank you. And again, before I get going, I want to really thank Natasha Walker for sending out the e-blast last night, because I didn't get everything over to her late. So, Natasha Walker, thank you. But again, back to you. So, again, tell me about yourself.
So like I said, I grew up in Santa Monica. I'm a small business owner. I've been in the medical field for a very long time. My fibroid journey started about 25 years ago when I was first diagnosed with it.
Okay.
With them. And I think I had probably like 2 small ones at that time. And within a couple years, they had become really, really big.
Yes.
By the time I was 31, I had a myomectomy. And you talk about the different types of fibroids. Mine are all in my uterus. So, in my uterus. And a couple were actually embedded in my uterine walls.
Yeah, and they can be in the uterine walls. They can almost look like a little grape connected to a vine.
Right.
One of my patients here recently had, I think, 27 removed.
Wow.
And they were easily removed because of the fact that she was doing some other things. But the most I've had, and this was about 13 years ago, was a person who had 45 fibroids.
Wow.
And they were in all 4 areas, to the point they were pushing up against her lungs.
Oh wow. My gosh.
They were huge. But she went on a program that I had her on, and she said, I just don't, because there's emotional components linked to fibroids as well. And she just didn't want to go through that again because we had shrunk them. We were able to shrink them because I watched and monitored through ultrasound, see what's going on with the person. And but she just didn't want to go back there again. She said, I'm just going to have surgery. So I do pre-surgical nutrition as well. So people, anyone scheduled for any type of surgery, especially fibroids or any type of surgery, to do pre-surgical treatments with me, which is intravenous, your healing process is just amazing. Actually, the surgeon came out of the room because I went to the hospital with her and said, those were the easiest tumors I have ever removed. It was like clip out in Irvine, and they were gone.
That's amazing because they couldn't get all of mine when I did my myomectomy in 94.
Yeah.
They did not get all of them. 6-hour surgery that was supposed to be 2 hours.
Oh, my.
And so with that being said, some were left embedded in my wall. I had not had my son then, so all that was on the table. What should we do? I ended up just doing a myomectomy, which is just removing the fibroid tumors, and leaving the uterus
in place.
Yeah. Mm-hmm. And so with that being said, I did, they did grow back 6 months later. Mm-hmm. And so I was almost where I started from. They were big. I had about 6 of them. One was 12 centimeters. My uterus was about a 4-month pregnancy. Mm-hmm. And just really annoying.
Oh, I can imagine.
Right.
It's pushing on the other organs.
Well, mine are posterior, which press on my bladder and my kidneys.
Yeah.
So because of them, throughout my life, I've been hospitalized twice for kidney infections. Mm-hmm. And it weakens your kidneys, so then you're always
it's definitely going to
prone.
weaken now.
Right.
Mm-hmm.
So
there could be some incontinence as time go on, and it's just a lot of problems.
I didn't have those issues, but I definitely had the bladder infections, the kidney infections, and all that stuff.
So, listeners, if you have or had a history, or you haven't repeated bladder infection, kidney infection, maybe you want to make sure that you rule it out, that there's not a fibroid there. You want to definitely rule it out. If you're having some of these symptoms, because a lot of times we would find it in hospitals when I worked hospitals a lot because a woman would keep complaining of heavy menstruals.
Right.
So that's one of the key things.
Which was my life from the beginning. I've always had that. So I think it's probably hormonal. Maybe. I don't really know. I know it's part diet as well.
Diet is a major
right.
cause.
And I even went when I was going through this, I went 3 months microbiotic diet and everything. And, I felt better, but I don't know if it helped that much. Mm-hmm. So eventually I wanted to have a baby a few years after that. And I was going to all these different doctors, and I actually went on Lupron. And after taking that for a couple weeks, I woke up one day and my eye was 2 sizes bigger, and I was going through all this stuff, and I was like, okay, I can't take this stuff anymore. Yeah. Fortunately enough, I got pregnant about 3 months after that.
Okay.
And I do have a son. So I'm very grateful for him. Thank you.
Congratulations.
Thank you. He's grown. He's almost grown. He's a teenager, but I'm very grateful for that.
Okay.
So let's fast forward a little further. Mm-hmm. Perimenopausal.
Yes.
My fibroids went crazy. They grew even bigger. I was at my wit's end with them.
Yes.
And I actually scheduled a surgery. And I was going to have my uterus removed. I was going to do the whole thing.
Oh, my goodness. A complete hysterectomy.
Yes. And I went through the pre-op, physical, everything. And the morning I was supposed to be at the surgery hospital at 5 a.m., I called them and told them I was not coming.
Oh, my goodness.
I decided
it
not.
just brings tears,
Yeah. They were like, why? I was like, I can't do it. I just can't go take my body through this again.
Yes.
And I went on. This was right before the suppositories became a part of my journey.
Yes.
And I went to homeopathic doctors. They gave me progesterone pills. That was the only thing that could balance me back out because I was having a lot of issues, bleeding. And,
yes.
they were
And
about
the
to give me a transplant, transfusion, and all this stuff, and it was just way too much for me. So I would just take the progesterone pills to get back balance, and then I would go off of them.
Yes.
So they wanted me to stay on them all the time, and my body did not feel good. So I would take them for a couple days, get myself balanced, and I would get off of them. I would not continue taking them.
Right.
So when my business partner here became sick with the MS, and she started taking the cannabis oil, I decided to take them for health benefits, not knowing exactly what it would do, but I needed to balance myself because I decided not to do the surgery. So because of that, I took the suppositories vaginally.
Okay.
Instead of the other way. So because I wanted it to get to my uterus.
Of course.
Right.
Of course, yes.
So with that being said, there was a bit of a healing crisis, like bloatedness and hardness, and I didn't really know what was going on at first. But after I would get bloated and the fibroids would get hard, I would just release them. Like they were starting to just come out.
Yes.
And after a while, I started feeling better. So when I was going through the perimenopausal and all that stuff, everything just started balancing. And I have not looked back since. I have just one fibroid, which is about 6 centimeters now. And all the other ones we cannot see. And I have an ultrasound business, so I get to look at my uterus quite a bit.
Good for you.
Right. So my tech was looking the other day, and I'm like, where are they? And so at least 4 of them had disappeared. I did not realize it. And now my stomach has gone down. I actually lost 25 pounds.
Yes.
And
so if you're underweight, it's not going to cause you to lose weight. I just want to make sure that's clear because I have taken them and I have lost weight as well. And I love them.
Which we have a product for that,
yes.
which is a suppository as well. It's another special blend of ours. But with that being said, I have lost 25 pounds and I feel great. Thank you. And I feel great.
Yes.
I feel so great. I feel like I never went through that stuff. My body is happy.
Yes.
So I'm still on my journey. I need to shrink, more. So I do continue taking them. And hopefully one day I won't have any. So.
You will not. You will not. And this is such a passion of mine because I would say, one of my daughters, when she's in her 30s, but when she was 15, she had to have an oophorectomy.
Oh, wow.
Ovary and fallopian tube removed for a fibroid tumor.
Wow.
Can you imagine? At 15, she was 15. At 15 years old, to have this done. It had actually wrapped itself around the fallopian
organs.
tube, and it was just horrible. And she was a runner at the time. She was doing the Olympic running during that time, and she kept saying, I have this discomfort. So that's how we end up finding out because she was a virgin and all the other, and then she kept saying, Mama, what's going to happen later? Now they removed the tube. I have children, and I'm happy to say I have 2 grandchildren from her.
Nice. Yay.
Which is a blessing. So she had it done at a very, very early age. And, she's very astute when it comes to her diet and nutrition and everything. So I'm just so happy that, I wish I'd known about this then, but she's fine and we have our grandchildren.
Right.
So.
And I have my
She
son.
has her children.
Yeah.
Yeah. And
I'm very grateful.
My granddaughter and grandson. So
yeah. And that's another concern. Like when you have fibroids and you go through a pregnancy, like I have a friend who the baby's hand, her daughter's hand got caught in one of the fibroids. So it became deformed just from being caught in there with it. So, there's a lot of things that can, happen that are not
Yeah,
good
I have
with
another
fibroids,
friend, and
so.
she has some other problems that it just cuts off the oxygen circulation, so she can't have children. So she's going to be starting on the program. She's going to
Awesome.
be starting.
Awesome.
Yeah. So
I think that what it did for me, the cannabis oil did for my fibroids, is it's kind of the embolism that they want us to do. Like that's one of the things
that's
that
one
you
of
can
it. Same
do.
thing that
right.
does with the cancer is
So
yeah.
I think this does it kind of naturally, where it just kind of stops.
and angiogenesis.
Right.
So you don't have that. You don't have the tissue
So it
still
just-
growing.
It's
You
just
don't have
killing them. It's
you're not
cutting off the
feeding
blood.
it. Yeah.
Right.
And I
You're-
know that
yeah.
it also
Right.
cuts off the blood source.
So
Right.
that's what
It's
you want to
cutting
do.
off the bad
you want to
blood
cut it
supply.
off.
Right.
Exactly. So
and it shrinks them and just gets rid of them.
because today's show is basically on the fibroid and MS, but we know that the cannabis is just good for so many things, and I've seen so many things turn around with people dealt with the cannabis.
Right. Well, I tried, diet. I tried, like I said, I tried surgery. I tried a lot of different things, and this was the only thing that did this for me.
So, ladies, please share this show with your friends, family. The one thing you want to make sure that you do not have in your diet that will feed the fibroid tumors is foods that are high in estrogen. Do not do that. Do not do any soy. I had a patient who said, I'm going to become vegan. And this was about 30 years ago. And I said, okay. But she did everything soy, the eggs, the tofu, the everything. And the fibroid grew 100 times in size in 30 days. 100 times in size in 30 days.
That's amazing.
So, we wonder why. Stress. Stress has a lot to do with it. And when we talk about even MS, we have to really, still look at the stress factors. There's a gut-brain relationship. So we have to know what is going on with with your colon, and also SIBO, small intestine bacterial overgrowth. So it's the whole picture when we're going to heal and heal completely. So we want to make sure all of that is in order. And there's certain tests we can do, and there's urine tests that I do to check to see what enzymes are better for you versus others. And you're not just taking just an enzyme, because a lot of people are taking so many different type of enzymes that don't know is feeding into
Correct.
the tumors.
Yes.
I wish I would have known you when I started on my journey, because I did everything by myself. And I didn't have any kind of medical guidance at all. And I think it's so important because, like, for instance, you saying not to eat things with high estrogen, I would never have known that. Mm-hmm. And I think that there's a lot to say for us creating something on our own to figure out what would make us better.
Yes.
But it's also a good thing to have someone there with you who can guide you and really tell you what you need to do.
Yeah.
So,
and then we have
not just give you a prescription for pharmaceuticals.
No. That's why I could not work hospitals anymore.
Yeah.
And actually I think they would have fired me after a while, because it's a lot I just don't agree with, and now I'm having medical practitioners call me because they said I can't be in this arena anymore. I had a call just on my way here today. This lady been in the hospital for years. She said, I can't do it. And it's like I've been telling everybody, the generic medication is no longer that substandard generic. It is something else, and I don't know where the heck it's coming from.
I actually had someone that I've been giving the suppositories to, and she has some sort of problem with her kidney. And I've just been giving her the medication because I've been seeing her at work. She's a single mom, has 2 kids, has to do work every day. And I would walk into the liquor store where she works, and she just is laying her head on the table, doped up from all the medications that they're giving her, and she can't handle it anymore. So I started giving her our suppositories. And when I saw her, she was like, oh my God, I can't believe how much they helped me sleep, because she was not able to sleep. And she started taking them. She told her doctor she didn't want to take the medication he was prescribing to her anymore. Mm-hmm. He got very angry with her.
Of course.
And But I'm seeing her now, and she looks amazing, and she's actually functioning.
You're going to look amazing when you sleep, because sleep deprivation can destroy you.
Yeah, she was.
And people,
really
when they're not sleeping, they also can have burnout. And when you have burnout, guess what it does to your brain? Your frontal cortex of your brain can shrink.
Really?
So the research is out there now. You can have burnout like that. So we have to be careful, everyone. If you feel that you're overworked and stressed, I tell people, check your cortisol levels. You can go to lifeextension.com and do a 24-hour urine cortisol test. You don't need a doctor's prescription to do this test yourself. See where you are, because that's going to burn out your adrenals. You're going to end up with, prayerfully you don't, cancer, and all these things happen from burnout. So when you don't sleep, you don't function well. You're not going to be productive, and it will cause heart disease. Less than 5 hours of sleep is heart disease as well. Yeah. So I'm going to do a whole show on sleep hygiene, which is so important, because sleep hygiene is, you have to deal with that. Don't put the cell phones near the bed. Don't sleep with any lights on. Don't put, I had one girl had headaches all the time, but she had the cell phone under her pillow. One girl kept the Bluetooth? He kept it on his ear so long it grew into the tissue. It's like, how do a person keep, I didn't get it, but it had to have surgically removed.
Crazy.
The things I've seen and heard, there isn't probably anything I have not seen or heard. So, keep those electrical devices from you. And I just want to say this, your cell phone, especially, I think it's iPhones, have it inside there under, what do you call that when you go down? On
the terms of agreement?
Yeah. On the terms of agreement and everything, it's on there to keep it so many feet away from you, because they're not responsible if something, the EMF. So it's in there. And we buy phones, we don't look for that. We just go and set it up and start talking on it, but keep it off your body. Keep it on airplane mode, because it's, and then if you need to, someone's calling you or you need to call out, then check it. But please, keep those phones off your body.
I see women put it in their bras or their shirts
breast
all
cancer,
the time.
We had a show on it. Breast cancer, put it in the back pocket. Men, testicular cancer. Some people put it in the pouch in the front of them. Prostate for the men, ovarian for the women. And we know that it leads to brain tumors. We know.
Can I interject with something? Because
Sure.
you mentioned prostate cancer, and with respect to our suppositories, we have some people who have actually used it to help alleviate some of their pain.
Well, I have testimonies from it.
Oh, you do?
Yeah.
Yeah. So,
So thank you.
Yeah.
Yes. Yes. So it's been really great for the men. They don't have any pain, and the pressure they were having.
and it sits right there. The medication is sitting right there, helping it directly.
Exactly. So, and even I'm noticing the PSA levels dropping, because I do lab work as well. So I'm doing functional blood work.
Right.
So I'm just not going on how you feel. And ultrasound is so important, so we can monitor the rate of shrinkage of the tumor. So I am so happy for Lisa, because that's her business.
Yes.
I love the name of it. I was calling it Peekaboo.
It's Peekaview for the 3D, 4D
Peekaview,
pregnancy
not
stuff.
Peekaboo.
Peekaview. Yeah, Peekaview. Like
Peekaview.
Peekaboo, but Peekaview. And then it's
Peekaview.
Santa Monica ultrasound for the diagnostic part.
Three-dimensional. That is so. I can't wait to see my grandbaby.
Oh, yeah.
Because my youngest daughter's pregnant now.
Oh, it's amazing.
Yeah, so
It's
I want to
amazing.
see a three-dimensional on her.
Right. So.
Yeah. So I just want to thank you both. I mean, this has been wonderful. Again, if you know someone or you happen to be suffering yourself from any condition, because I've been through it. And I can tell you one thing that is phenomenal for, and that's hypertension.
Really?
It is wonderful.
That's what we're hearing.
In 4 days, my blood pressure had normalized. I used to run a 220 over 160 blood pressure. In 1992, and 10 years later, I was in a coma from high blood pressure.
Oh my gosh.
So I am very strict when it comes to sodium and, taking care of my health and eating right, because I've been in 2 comas.
Well, you look beautiful too, just to let you know.
Thank you.
I don't know if it's our suppositories or what, but you definitely look beautiful.
And I'm so grateful. But I tell you, that was the first time something worked that fast. And I take L-arginine products and wonderful, great products for cardiovascular. The one thing I like is I give myself the coenzyme Q10 injections IM, which is really great for the levels. But again, to know what your levels are, I don't guess, I test.
See, this is what I like about you so much, because I had been just figuring it out on my own. Had I had known you at that point, I didn't even know about lifeextensions.com or the blood panels that you could just as a normal consumer go and order.
Exactly.
I looked at the whole list of everything and thought, well, I definitely need Dr. Lee, because I don't know which ones to pick.
And the good thing about it, and the good thing about it, you can look at the list and then click on, and it'll tell you what it's for.
I did do that, but I still felt like
overwhelmed
and a little guidance would be needed. And I thought, okay, I need to talk to Dr. Lee.
And that's what I do.
Yes.
So we cover, if you just do the male, female, everybody know what their vitamin D3 levels are, because that's now linked to cancer. And I think people with vitamin D, lower levels, I think too, I have to double check the research, it's linked to fibroid tumors too. So when you keep it 60 and over, stroke, cancer, dementia, and all these things you won't tend to have. Well, you won't have dementia because you won't be put on a statin drug. So just
Well, Dr. Lee, I want to tell you, thank you so much for having us on here. And I am so grateful to have met you and to have been working with you. I've seen a couple of your patients that I've met. They're just so happy. And I mean, just some amazing, amazing things that you have done. Just the little time that I have known you. So I'm very grateful.
We all have been gifted and ordained for something wonderful in your life. I tell everybody. And what you two do, it's just amazing to help other people. So there's no accidents and why we do what we do. I wouldn't even have a show that's going to be this wonderful had not been for Jarvis. So
thank you, Jarvis.
Thank you, Jarvis.
So I just thank him so much, because he really spices it up. And not so much that, he pulls in wonderful information. So if a person is watching the show, they can see, not just see us, which is great, you're seeing us, but there's more information. So Jarvis, I just love you, and I love the work that you do for this show. It's just helping to really educate a little more, because pictures are worth sometimes more than 1,000 words, and people are listening, but they can see. But if you are listening through iHeartRadio or you're listening to UBN Radio, you can always go to our YouTube channel, NuWellness, New is in you, NuWellness TV with Dr. Lee, and you can watch the show. We do have a YouTube channel. So I just want to thank you both for being here. And parting, if you could do it in like 15 seconds, what would you tell the audience quickly? I
would quickly say to just go visit our website, suppositry.com. You can go to the Learn section and learn a little bit more about the suppositories and give it a try. And
they go to our link.
Oh, I'm sorry. Yes. And you definitely want to put in coupon code. If you decide to visit, it's suppositry.com/Dr. Lee. Coupon code is Dr. Lee in case you decide to make a purchase.
And you will be making a purchase.
You have a special price. She's had it all set up for you.
And I would like to say to the audience is take care of your cannabinoid system. It's really, really important.
It really is.
For all health.
Yes. Everything. And you don't have to worry about being tested and come up and show that you are taking this. You'll be fine. So repeat after me. I am. We have to wrap up. So grateful.
So grateful
that I am.
I am
a magnet.
A magnet
for miracles.
For miracles.
And so are you. Have a wonderful, blessed day.
Thank you.
Have a blessed day.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.